So, my name is Jordan Lehman, and I chose to do my presentation on the bacterium Escherichia coli or E. coli. And I specifically chose strain 0157H7. So, a little background on E. coli is that E. coli is actually typically harmless, which I didn't know before beginning to study this bacterium. So, humans actually possess multiple strands of E. coli in the intestinal tract that are important for creating a healthy gut. But it's extremely important to note that most strands of bacteria are harmless, like I mentioned. However, I picked a strand of E. coli that we would probably be more typically attuned to hearing about, and it's pathogenic. So it's strain Z0157H7, and it's known as Shiga toxin producing E. coli, or STEC. So the primary focus of today's presentation will be on STEC, and this strain specifically causes severe foodborne illness. So a little bit on the reservoir of the STEC strains of E. coli is that it's found in grass-feeding animals, specifically cattle. So the primary reservoir for STEC is in ruminant animals, like I said, and their optimal growth temperature is 37 degrees Celsius. But it can grow in a wide range of temperatures, all the way from 7 to 50 degrees Celsius. Beef can become contaminated by fecal matter, that is, the beef that we eat, through poor processing methods during slaughter. Feces may contaminate other foods and water, but I'll get more into this later on in the presentation. So here's just a picture of what this pathogenic bacterium looks like, and it's actually a gram-negative bacterial rod. So it inhabits the intestinal microflora of ecosystems in which most mammals and bird species live. It grows in the large intestine and attaches to the intestinal wall and produces toxins that can damage the mucosal and vascular endothelial cells. After the gastrointestinal barrier has been breached, the toxins gain entrance into the circulatory system and can travel to other host tissues, including the kidneys. So, after gaining a greater understanding for the specific strain of E. coli, it's important to understand the mode of transmission, or the progression of the infection and its effect on the host, aka the pathogenesis of the disease. So I wanted to include this picture because I really like how it displays the pathogenesis of STEC. So first, ruminant animals or cattle ingest the pathogenic E. coli, and then through excretion of feces, it can contaminate the environment, which then contaminates our food or water, and then that contaminates people. Or people who are working in the farms and slaughterhouses can get directly contaminated through their work. So, potentially pathogenic bacteria are ingested by the cattle and other ruminant animals. And these bacteria then, once they get into the body, they colonize the intestinal tracts. But they do not cause any disease in these animals. It's not until the bacterium are excreted in the feces, contaminating the environment. So the contamination of the environment can happen through the feces runoff, contaminating our drinking water, or contaminating our food by using the fecal matter that it's in, and then it can cause person-to-person spread. So the bacterium colonizes in the large intestine, like I said previously, and causes attaching and effacing lesions. So the receptors inject into the host epithelial cells via a syringe-like bacterial apparatus. That bacterial adhesion mediates a very intimate attachment of the bacteria to the cell receptors, and bacterial signals stimulate effacement of the microvilli and reorganization of the cell cytoskeleton. So the adherent bacteria produces a toxin which is transported across the epithelial cell to the circulation. Now, this toxin acts on the endothelial cell of the blood vessels, and this is when the, I guess you could say, bad outcomes begin. So that includes non-bloody diarrhea or bloody diarrhea, abdominal cramps, vomiting, fever, and in serious cases, hemolytic uremic syndrome and acute kidney failure. So now that we've talked about all this, what can be done to prevent and treat these sorts of E. coli infections? Well, there is no evidence that treatment with antibiotics is actually helpful, and evidence actually shows that taking antibiotics may increase the risk. So, here are some of the treatment and preventions that people have shown to be important when trying to prevent or treat this disease. So the first one is just cleaning and sanitizing all surfaces. You want to basically do this for all cooking methods and things like that, just to be careful and prevent the spread of the disease when cooking. You also want to make sure that you are cooking meat thoroughly. So I attached this little picture for reference to show at what temperature you should be cooking through all of your meats, and then leftovers, eggs, things like that. Drinking pasteurized milk can actually help. Washing fruits and vegetables is super important, which I'm a culprit of not doing that. And after reading this, I was really sold on washing my fruits and vegetables. And then also hydration can help. So, although contracting this pathogenic strain of E. coli through cross-contamination of meat, produce, and even water appears inevitable, implementation of these easy daily practices of prevention can dramatically decrease the risk of STEC infections. So, just wash your produce, cook your meat to the proper temperatures, and stay hydrated, and you should steer clear of being contaminated by this pathogen. So that's all I have for this presentation, and here are my text sources.